Years ago, I worked in orthodontics. I was on my feet majority of the day. And you especially do not want your patients to feel uncomfortable in your dental chair. It is so important to train new people properly. I think it's important to invest in your staff. Oh my God, if you're short something and you run out of a material, oh God, good
So,
luck.
good afternoon, Wealthy Dentist podcast community. We have today Joanne Ignatoff with us. She's going to bring her 30 years of experience to us today and give us some really good information about dental assistance and how she spent several years, and 7 to be exact, and counting, on just educating dental assistants and getting them ready for the real world. Join me in welcoming Joanne Ignatoff. How are you doing, Joanne?
Hi, Ward. Thanks for having me on today. I really appreciate it.
Mhm.
Um, yeah, I'm excited to be here and share, my experiences and what I've come across in the past, close to 30 years that I've been in this industry for. So, yeah, I'm excited.
So, what got you involved in the dental industry in the first place?
I'd say, when you're younger, there was always something in me where I knew I wanted to help people. And I always knew it was either the health field or the fitness field that I wanted to end up in, or somehow a combination of both.
Oh,
So when I ended up getting into dental assisting, you know, um, long time ago, what I ended up realizing or finding out was just the impact you have as a dental assistant um, on your patients. And when you see that and you start building a trust with your patients and just a rapport, it ends up being really rewarding. So the field has always been something where, it's you're always learning, but at the same time, it's so rewarding and it is such a rewarding field when you find a really good practice to work in.
mhm.
So
So, okay, so you got involved. You wanted to be in either the health field or the physical field. I mean, like, I don't know. So, is that something that you were able to? I don't know. I'm trying to figure out why did you decide dental assisting over fitness? Because it just seemed like they're so close together. Was that a tug of war, so to speak, for you?
well, when you think about it, it was it was a but being a dental assistant, I have found, and I've always, something I taught, and when I go out, it's something I let people know is that it is it can be such a busy day, and you really truly have to have the energy to keep up with everything that's going
Mhm.
on a daily basis. So, depending on the type of practice you're working in, I feel, for me, I'll say years ago, I worked in orthodontics. I was on my feet majority of the day because you're constantly going between hygiene and doctors and running around. That if I didn't have the stamina to keep going, I'd be wiped.
Yeah.
And so I think it's something that people should really take the time and think about, because investing in your own health and well-being, as well as being in the healthcare field, is truly such an important thing. So the two actually tie in together.
Absolutely. Totally agree. Totally agree. Spot on. And while we're thinking about that, tell us what a day looks like or what your day used to look like when you were running from operatory to operatory, here and there, grabbing a drink of coffee and getting back in there, carrying all these various instruments, hitting all of these buttons to get things moving. What does that look like for you?
So on it, and that's the thing is that, you're dealing with patients. You have, the patients that are fabulous and easygoing and easy to talk to. And then you have patients that can be challenging throughout the day.
Yeah.
And you just have to be prepared on all levels. And it's having your room set up and everything ready to go. It's being prepared and knowing who's sitting in your chair that day or for this particular time, let's say for this procedure. Most of the time you already know the patients if you've been in a practice long enough. So you kind of have an idea of what to expect just from them. Um, but and I think it's just, and that's the biggest thing. And I think if you're talking about what to expect on a daily basis, it's something that I found to be super important was really starting off our days in the practice with having morning huddles. I cannot tell you how much that just helps set the tone for the day and talking about who's actually, like I said, who's coming into your chair. This
Mhm.
is what they need. Or this is what happened at the last appointment. Make sure something, that doesn't happen again. And we got to do this better. And it's just an overall mindset of mentally being prepared as to what to expect. Because I truly remember not having morning huddles in certain practices
Mhm.
and going in and you're just flying by the seat of your pants.
Mhm.
And then other practices that I worked at, they have these morning huddles and it really helps bring the team together in the morning, even though it's starting to get hectic and people are, getting ready to see their patients, talking about what's happening, having the doctor in on that meeting is a game changer. It really, really is. It, like I said, it's just such an important part of the day and it helps you prepare for what's to come throughout the day. There's less worry and there's more like, okay, I already know this was going to be here. I already know this patient was going to be here. I have everything ready to go. Let's go. Let's do it.
Mm-hmm. Mm-hmm. Yeah, so I see the all of the things that's going on with, with the mindset, you know, uh, having the physical energy, knowing your particular role as a dental assistant, having everything prepared. Um, it can be kind of a challenge if you start really thinking about it. So I guess a lot of the things that you do, um, it just come natural over time. It'll have to because if you think about it, it'll just seem overwhelming. What you think?
And it's true because and this was something that I really tried to implement when I was an instructor, a dental assisting instructor, because if you're not prepared,
Mhm.
it's just you're all frazzled and you're stressing out. So the whole point of being prepared, it helps to reduce your stress, the
Mhm.
doctor's stress, throughout the day. Because what we have to remember is that if we're stressed and the doctor's stressed, you have a patient laying right there. You can they pick up on how you feel. There's
Yeah.
that energy that's emitted from us
Yes.
where there's tension and nobody likes to feel like that. And you especially do not want your patients to feel uncomfortable in your dental chair when, a lot of people already have, a nervous feeling.
Yeah, they
Just
have
you
that
want them to
anxiety.
make to be made to feel as comfortable as
Mhm.
possible,
Yes.
even if they're nervous. That's your job. That is the other part of your job.
Hmm. Yeah, managing. Is it behavior? Managing the mindsets of not only the patient, but even with the dentist at some point, as you move through. I mean, just to make sure that he or she has what they need to get through the procedure of whatever it is that you all are doing that day, and making sure if there's I mean, do you all find yourself, matter of fact, needing like a fallback instrument if the certain instruments that were ordered for that day are not the ones, or there's something missing with this certain instrument? I mean, like, to me, I would think, you know, we're all human, right? There are going to be times when we don't have what we need as an assistant, or even as more importantly, the dentist. They might not have what they need to do the job that they need that's at hand at that particular point. I'm just wondering, uh, about the flexibility that or experiences you all have uh, to create, a situation where you can kind of make it through the procedure with unscathed, if you will. I mean, have you found yourself or situations or heard of situations where, you know, they're experiencing those kinds of
Yeah. So I think, and this is the part about being prepared in the morning. So the biggest thing is that you, as an assistant, should know which patients you're seeing, especially if there's more than one assistant within your practice.
Mhm.
So we used to go, okay, I have this procedure because it's a long one. You get the next long one because it kind of gives that assistant a break to sit down.
Oh, oh,
And then I'll be doing the shorter appointments, kind of running around for that
okay.
time period, or
Yeah.
vice versa. So you know to switch. So the biggest
Okay.
thing is about that is that if I know that I'm the assistant
Hmm.
that is sitting down with that particular doctor, and you already know who's doing the procedure, you know what instruments they like, or at least you should know,
Hmm.
because the biggest thing with working, let's say in a bigger practice that has multiple doctors, if you are working with different doctors, is that every doctor works somewhat differently. And a tray setup might not be, even though it's the same procedure, it
Hmm.
might not be the same instruments for this dentist as it is for the other dentist.
Yeah.
So that's up to you as an assistant to be, ahead of the game. You always need to be one step ahead.
Mm.
You always need to be maybe even two at times, 1 to 2 steps ahead of the doctor so you know what's coming. And this in time, yes, does come with experience and
Hmm.
getting out there more. So,
Hmm.
for somebody that's newer, this is where they need the guidance to really understand what's going on, because there really should never be something missing when you sit down. Because ideally, what you don't want, if you have to get up or ask somebody to get you something, you're
Yeah.
wasting time. And the
Oh,
whole goal is to be efficient.
yes.
You want to be as efficient as possible and you want things to run as smoothly as possible while you're working on that one patient. It's
Mm.
everybody's time in our hands because that patient may be there on a lunch break. You want to make sure that you have everything set up, ready to go because they want to get in and they want to get out. And they also don't want to wait. So if I'm saying, oh, hey, so and so, do you mind grabbing me this instrument? Because technically, I shouldn't even be getting up from the chair to go get anything.
Okay.
So that's a waste of time right there. Now we're going to potentially, if things are missing and that makes the doctor frustrated, you don't want to have that energy all of a sudden starting to change when it's been going really well.
Mm.
So you have to create this, you know, fluid flow when you're working over these patients so that they don't pick up and sense that. And, if you are, let's say there is something missing, generally in the operatories, there are drawers that have other instruments or extra instruments within them, and then there's a whole lot more that goes along with that, with trying to get those instruments out of those drawers without contaminating anything else that's in there. So
Yeah.
it's having over gloves on, using a sterile plier to go into that drawer and take it out instead of putting your dirty hand into the drawer. There's infection control protocols that need to be followed.
Hmm.
So there's a whole lot that you have to think about as an assistant and the practitioner and the doctor that you're working with, because you have the patient's health and safety in your hands. And it's also your health and safety in your hands when
Yeah.
you're working over patients. So there's so much involved and a
Mm.
lot to think about. And truly, when it just becomes, when you're just out there for a long period of time, it's something that just happens. In the beginning, it might be a little more stressful because you're trying to compartmentalize everything and make everything happen all at once so that it looks fluid. But you start to sense that breakup of every little thing. And that's not what you want. You want it to just flow nice and smooth. And again, it's in everybody's benefit to have it get to that point so that, again, it's efficiency and it's time.
Oh, that's interesting. So now, uh, if we can, um, or if we could, can we talk a little bit more about the process of contamination, the protocols, anything that you might want to talk about in a little bit more length there when you're setting up. Yeah, you want things to flow, but then things don't flow. Or maybe not even that issue. It could be some other situation where we gotta have this type of protocol in place to make sure everybody's in line or in sync with this process. What would that be?
So so what I would say to that is there has to be really, really clear communication. There has to be clarity, and there has to be whoever you're explaining things to, they really have to not only listen, they have to hear what is being said.
Okay.
Because, like I said, that's the patient's health and safety in your hands. So, even as far as when you're setting up, so a lot of instruments they're wrapped in it's the wrap that you sterilize everything in.
Mm-hmm.
No instruments or anything should technically be opened up until that patient is sitting in your chair.
Okay.
Because those instruments, once they're opened, are technically not sterile anymore.
Oh, wow. That's a good point. Yes.
Okay. So, and when you are opening and setting everything up,
Mm-hmm.
you should be wearing gloves because anything that's going into your mouth, I shouldn't be manhandling with my hands and setting up on the tray. And then
Okay.
that actually happened to me
Oh.
at my dentist. I went for an appointment.
Mm-hmm.
I went to have a filling done. And I was sitting there, and the assistant came in and she opened everything up. She touched the hand pieces with her bare hands. She touched the instruments with her bare hands. Proceeded to walk behind me to where the counter was with all the materials. And I had turned around to look because I was keeping an eye. And she said, "Oh, are you looking for anything? Are you okay?" I said, "Yeah." I said, "I'm just watching." So I ended up saying, because, and this is the other side of it, you never know who's sitting in that chair.
That's so true.
Okay. So I was like, oh God, like she just touched everything with her hands. And I don't care if she walked into that room and sanitized. I don't want that. So I ended up going out after the procedure and I actually said, listen, it's, they know me in the practice and they know what I do. And I said, I have to tell you this because of what we just said. You never know who's sitting in that chair. Your assistant needs to be wearing gloves when she is opening those instruments and getting everything ready for the doctor. I said she should not be touching anything that's going into any patient's mouth with bare hands. That includes saliva ejectors, high volume suctions, any of the hand pieces, any syringe tips that go on, any of the materials that are being used, like nothing. You have to understand, like there was times where, we were working on, like when I was assisting, and on the clinical side and talking and nothing had gone wrong. But then what I ended up realizing, because I saw my doctor talking with this woman and she ended up being another dentist and her child was in the chair. We didn't do anything wrong. We were using all our gloves. But my point is, if we had done something that was not right, I'm sure we would have heard about it. So it's really important to make sure that everything is being done with precision. And again, it's proper onboarding and training for anybody new coming into this practice and making sure this is what I'm doing. I'm going out and this is where I help dental assistants if there's not the time for somebody within the practice, because let's say there's only 2 assistants working in that practice. When am I going to have the time to fully sit down, unless it's outside of hours, which is fine. But then there's a whole other issue with, am I going to get paid to sit and train this assistant? So there's got to be clarity and communication and really, like I said, the proper training, which is the onboarding when somebody new is coming into a practice. So that's how you prevent those mess ups and those slip ups, because those are serious. You could have somebody from, we call it's public health, come in and audit your practice,
Mm.
or come in and maybe that's the person. What if I was that person that assistant was working on when she handled those instruments with their bare hands? Do you know that office would have got a warning?
Mhm.
And if they don't fix things up, they shut down.
Oh my goodness.
Yeah, it's very
Oh,
serious here.
oh, that's interesting. So how many strikes do you get? Do you get one and
Well, I
that's
think it
it?
depends on like it's like this, what is the severity of what's going on? If
Okay.
it's something that could be corrected, they may get a warning, come back at another time and make sure that that was changed. If it is something massive that has, literally sterilization protocols aren't being done right, they're cutting corners on different things there, you could be fully shut down.
Oh my God.
Yeah. So it's there's so much involved when you talk about infection control. And, literally I know numerous people that just go in to train offices on infection control for practices. And there's courses that we have to take here too. It's to in order to be able to properly understand what's happening and do things by the book.
Yeah, I can see the level of seriousness that comes with that. That is just an excellent point. I'm wondering also, are there standard operation procedures that are written? The SOP, are these SOPs written for most over your 30 years of experience? Have you seen a consistency of those types of SOPs uh, literally written so that they can study them, they being the dental assistant, or for anyone for that matter that has whatever work they need to do within their expertise, those kinds of pieces of information are readily available, books ready, up to date, and that kind of thing. Have you
So
seen?
most, yeah. So most times when, depending on the type of clinic it is, like I've seen over the years, things change to the point where, closer to when I would say coming to the end of like the clinical side of things, working within a practice as
Mhm.
an assistant, um, things were being implemented more and more. When I first started, it wasn't as clear cut. So yes, there are binders that have everything you need in there. Some offices go to the extent of having binders set up with all of the instruments for each procedure, what every burr is, how everything is done, like step by step by step, which I think is like this is something that I'm doing with the offices when I go in and work with them, because it is so important to, like I said, to train new people properly, because again, having these things for them to reference is important, because if I didn't have the time to say, oh, make sure you have everything, I have something to go and look at for this procedure so I know exactly what I need.
Mhm.
Um, so again, it's just making sure that yes, those things have been implemented over the years. And like I said, I've seen the change where it's like everybody has this most of the time now.
Right.
So, and it only benefits the practice, because again, if you're taking the time to train somebody, you want them to stay.
Mhm.
Turnover costs more than investing in your staff to keep them
Mhm.
for retention, right? You want less turnover, higher retention.
Mhm.
So if you're investing in your staff, and that means taking the time to train them properly so they feel confident enough to go in and do a procedure. Let's say for me, as somebody, it would be, let's say, if I'm new to a practice, I want to have the confidence to go in and go, okay, I know how to do this. And I know the way that this doctor likes it done. So yes, I think it's important to invest in your staff. And that's one small way to invest in your staff. Because again, I don't think a lot of doctors realize the cost of turnover as opposed to just, higher retention. And I think people understand retention of staff members is way less costly than constantly hiring, like a revolving door. Some offices are revolving, and that's not a good practice. That's not a place that I can, right? What's the reason why? So, anyways, getting back to the binders, yes, it's important to have those for people to reference. And yeah, they're everything you need should be in those binders.
Yeah, so now I see that we're kind of pivoting, going towards what you're doing now, the Dentist Assisted Collective. What does that mean? You're the founder. What was your vision? What is the mission behind that?
So it's kind of, it's what I was saying is that I have found that over the years, even in my time working as a dental assistant and then going through and training, up and coming dental assistants when I was an instructor, is that a lot of dental assistants are often overlooked and undervalued within practices. There's not enough support on the clinical side for them to gain that confidence that's needed, because there was something that I saw when I was teaching, is that there's this controlled environment that people learn in. I'm there, their peers are there. I'm coaching you all the way through because my goal, again, I want to see everybody succeed at the highest level. And through that, I'm like, you guys have to really understand when you leave here, you're solo, you're on your own, and you're not going to have that comfort of having me standing there or your best buddy that you've made in the class by your side. And nobody's going to really care because they expect you to know what's happening when you get out there. So, and I'll say this, when I was in the classroom with them, the best example that I give is when they would come in, like we used to have our clinic time, for instance, like whatever time it was, I'll say it was in the morning. I'd say, okay, let's go in, sign out all your instruments, set up your units, get ready to go. And I would literally walk around and watch the clock and, and see how long it took them to do it. So if we started at 8, when they were, newish, and, we got the hang of going into the clinic, I'd say, when you're done, step out of your units when everything is set up and you're ready to go. Half an hour later, they're ready to go. And I'm like, that's unacceptable. Mm. And I said, that is not real life. Because you are in a controlled environment. And I said, I'm going to give you a taste. You guys know what you need, but you need to taste what it's like to be out on your own. So 2 things. There was usually 2 people to a unit. And I would say it doesn't take 2 people to put barriers on the lights and the chairs and everything else. It doesn't take 2 people to go, because we had to go and sign out a kit and bring it to the unit. You guys need to delegate to one another. Okay, Ward, you go sign out the instruments. I'm going to put the barriers on the chair. Not, okay, let's go over together and hold hands and do it. It doesn't work that way. So I'm like, right now, I said, once they were done setting up after the half an hour setup time, I said, take everything down, put it all back, and we're starting fresh. I said, I'm giving you less than 5 minutes for the 2 of you to set up that chair.
Oh my God.
And when the clock stops, I said, you step out of your chair and I'm going to come around and I'm going to check to make sure that everything is exactly the way it should be. And if you were behind, then we're doing it again. If there was one unit that was behind and didn't get everything done, we start all over. So that's what I found. There's a gap kind of in that comfort zone to being out on your own. And the thing is, with that, you can teach a whole class, let's say, and this goes in anywhere. Even when I'm out in the clinics, I can talk to people and tell them all the same stuff. But does everybody learn the same or hear everything the same? No. So this is where you have to figure out, okay, so what is the difference? Sometimes for me, when I was teaching, it's dexterity. Not everybody gets the hang of holding an instrument or a slow speed handpiece for polishing the same. It's heavier than an instrument. So I make them practice. It's on your own. Out in the clinics, it's the same thing. Where do we need to focus on for you to get you to the point that this practice needs you to be? So that's where, this training comes in, and you work with people so that they can succeed within that practice. And that was the whole goal. And, when I was teaching, like I said, that's the whole goal. You want everybody to succeed, but when it comes time for that graduation, is everybody as ready as somebody else? Not necessarily. So when they get out, this is where I say, this is what I'm doing, is I'm helping kind of bridge or fill that gap a little bit, because this is where, there's more attention on hygiene. And of course, the doctors, because they're high income producers. Well, if you didn't have the assistants within your practice, Would you have all the instruments you need? Would you have all the materials you need? Are your patients, getting the same instruction that they could if you didn't have an assistant? Not necessarily. It's kind of, you'd have to be more rushed. So this is where this side of things comes in, and what I'm doing comes to play, because dental assistants need more support within a practice, like we said, to gain the confidence where they get to that point where everything is just, you don't even have to think about it. You're on autopilot, right? And that's the point where you want to get to be. And you just want that synchronicity. There was a doctor that I know, and he called it's the dental dance. You just want it to flow like those, Dancing with the Stars, where they're all in sync together and everything's moving beautifully and flowing beautifully for that procedure. That's the goal.
So what would be the top five, what would be if we were to have a checklist, what would be the top five procedures that you would want in place if, you know, you wanted everybody to be, like you said, in sync, you wanted everything to be prepared? What would be something that will that
So I think
think it should be
that might depend on your practice.
checklist? Oh, I see. Okay, okay.
So most of the time, what are the most common procedures done?
Mhm.
Restorative procedures like fillings, crown and bridge, possibly. Now this is where it gets a little different. There's endo. Some doctors like to do it. Some doctors refer out. There's same with other restorative procedures. There's crowns, there's bridges, there's veneers. Um, and then there's again, it just depends on the type of practice that you're working in. And then you would have to pick from there and then focus on those ones. And then that's what I say. And then you go from there. So make sure that your assistants are trained on the top, let's say 3 to 5 procedures that you're doing.
Okay,
Mhm.
okay. So if you were to create a checklist for any of those, what would that look like? I mean, like if you
As
would
far
use general dentistry, for
So
example. I
general
know you,
dentist, let's say it's restorative procedure, just something simple like a filling. You have to make sure that your kit, when it's being put through for sterilization, because you have to take, so a lot of the offices have the metal cases for the instruments now, okay, cassettes.
Mhm.
So the instruments have to come out depending, and this again depends on your practice, go into an ultrasonic, or some offices have big hydrums that look like a dishwasher where the whole cassette goes in and it gets rinsed and all the debris from the instruments gets rinsed off. That's the whole point. If the instruments have to be taken out and put in the ultrasonic and then put back in, or put back in those cassettes, the person doing it has to know what instruments go in that cassette for each procedure. So that's where, again, the training and the onboarding comes in to make sure that that person knows, oh, this restorative procedure needs basic setup, mouth mirror, cotton pliers, explore, ball burnishers, any um, other instruments that are needed to go in there. Because again, if you don't have that, when all of a sudden it's wrapped and then you go to open it to set it up and you're missing something, that's not good.
Wow, that mean like so depending on what type of procedure you have is going to, and it's, I mean, it makes perfect sense, but you never think about this if you are patient in the chair, uh, depending on what type of procedure you're going to do, you got to have certain kits ready for that. I mean, like it's logical, but I never even think about stuff like that. And it's going to change. And so the dental assistant has to know what goes where, and it's almost like a puzzle. So if we're going to do like fillings today, this is what we need. If we're going to do I don't know, a crown today, totally different pieces of information, right?
Extraction, it's all other instruments, forceps and elevators and all kinds of instruments. It's totally different. So
Wow.
And yeah, and you have to make sure you have everything in there. And this is where, there's different size of kits. Basic setup is a smaller cassette. Restorative cassette is mid-size. Extraction kit is a little bigger because the instruments are bigger. So it's just and knowing what to put, make sure that when you're checking them, okay, it has everything. Some offices have laminated sheets with pictures of restorative procedure, endo procedure, crown and bridge procedure, extraction,
Wow.
hygiene setups, because you're still doing hygiene instruments as well. So again, it's just making sure that everything's there, ready to go.
So how many different type of procedures are you going to have in one operatory? I mean, like 20, 10? I
Well,
mean,
it depends. And again, there's so many factors involved here. So, how many operatories does your office have for restorative procedures? So, for the dentist, they may work out of two, they may work out of three. There could be more than one dentist working on a day, on one day. So, maybe they're working out of two, the other doctor's working out of two. Then you have hygiene rooms, and there may be one hygienist, there could be two, three. So, you have all of those other cassettes. So, it's not, some offices have rooms that are designated for certain procedures, yes. And then other rooms are just, they've got to be flexible because, again, if you're falling behind, you have to make sure that whatever op is open has what you need in it. And that's, again, this comes down to making sure that that operatory is set up and has all of the basics that are needed for each procedure in there as well. So there's lots of thinking. And I always say, dental assistants really are like extreme multitaskers within the practice. Because I'm not only sitting in this chair with that doctor working on this patient, I'm watching them. I'm thinking about what's next. I'm knowing who's coming in next. I'm making sure that there's instruments ready for me to bring into the next patient, and that all the, let's say it's a case, if you've sent something out to a lab, or are we milling it in the lab, do we have everything we need for that case to run smoothly, or for that procedure for that next patient to run smoothly? There's so many factors. Do I have enough material? Was it ordered? Are we short something? Oh my God, if you're short something and you run out of a material, oh God, good
so
luck.
who's, and now, okay, all right. That's interesting. So who's in charge of making sure that all of the instruments have been ordered for, I don't know, a week, 2 weeks? I mean, how far do you all go out with those kinds of supplies?
So as far as instruments go, instruments, you have your tray set up. So you should have enough instruments for the number of procedures you're doing. If it's materials that you need for, I keep going back to a restorative procedure, like a filling, it's the most simple example to use. Do I have enough composite for that? Is there enough prime and bond? Is there enough etch? Do I have enough cotton rolls? Do I have enough gauze? Do I have enough, you know, even the other things as far as barriers, headrest covers, all of these things
Oh,
that go when you're setting up a
yeah,
room for a
yeah.
practice. Who's in charge of ordering that? Well, there's a whole bunch of people, because what it comes down to is if I go in to the room where all the supplies are kept, and if I notice that I take one and there's only one left, I need to tell the person who's doing the ordering. Some offices have it set up where it's an assistant that does it. Some offices have it set up where it goes through a whole other system because they might be owned by a dental corporation. So it has to go through different channels. So there's got to be a list where it's set up and sent to the person that does the ordering for the practice. So if that isn't done and it's not written down that there's one left, or I took the last one and nobody, says anything, what happens when we run out? We're in big
Yeah.
trouble because sometimes it takes time, like anything you order from a store or Amazon, let's say. How long does it take to get to your house? It doesn't always get there the next day
Right.
like Amazon. Sometimes it
Exactly.
takes a week
Yes.
because you're not just shipping one thing. When you send an order in, you're sending a big order because it costs to send everything to you. You save money when you order more things.
Yeah. But then you
And
can also lose. There's a flip side to that, right? Because you can have stuff sitting and it's not even being used for months.
well, if you, this is the thing too, is that when you get a shipment and you're stocking it in your supply room, anything that's already on on the shelves needs to be moved to the front because it has it's going to have an expiry date that's coming up sooner than the ones that you're just ordering now. So all that stuff should be going into the like in behind that, let's say. If it's a material in particular that does come with an expiration date.
Hmm.
So something like bibs and gloves, that doesn't necessarily matter, or saliva ejectors and high volume sections, that doesn't necessarily matter. But yes, anything that has an expiration
Expiration
date,
date.
you really have to keep an eye on.
Yeah, the
So,
medicines as well, right?
and that's something that, again, when you're having, like, this is where communication, this is where training comes in. You need to let people know that are coming into your practice that are new staff members that this is how we do things. This is the system that we have. And that's what it's about, is creating systems for people to follow. Because, you know, if there's no systems or structure to follow, people are just kind of all over the place. But when you
Yeah.
have things in place, people have things to follow.
Yes.
And it really does make things run a lot more smoothly within practices.
I'm curious because this is to me data driven. Uh, particularly if you know what type of work you're doing the most. Seemingly should be some type of software available that allow people, assistants or whomever is ordering these different types of
Materials,
equipment,
supplies. Yeah.
supplies should know that, hey, when certain things get to a certain point, this is the time to do it. And you want to be as efficiently uh, as possible when you're making those orders,
Yeah.
because dollars, as you mentioned, are very important. Time is important. I mean, like if time's important, then ordering the right supplies at the right time is important, just as important, I would say.
Yeah. So, different offices have different like ways of keeping track of inventory.
Okay.
There's some have scanners, like you just go and scan a barcode. Some of them have tags, and maybe some of them don't even use those newer ways of doing things. But those, when you scan something, it goes into a system. So you can see what's
Yeah,
there and what's left. If you're
right,
just going in and manually writing something, things tend to get overlooked. So
right.
it truly is important to say, or have some other offices have cupboards where there's a list of things that need to be written, like a list of things that need to be ordered. So they'll write it down on a sheet of paper. Whoever is doing the ordering will go and take it and go, okay, guys, here's the date and that I need this done by. So if you see anything, put it on this list because I'm putting an order through by this date. So it gives people, a heads up. Or if you see that you're getting low on something, like this is where you know how many patients you have coming into your practice on a regular basis, like average, right? You know how much material you use for certain procedures on average. So you're kind of averaging out what is needed and how long it takes to get everything and how long what you have is going to last as well within your practice, right? So there's so many, again, it's how many factors are involved in this. I
A
have to think,
lot.
okay, how long does it take for that order to come? And if it does come, what if there's a back order, which means that particular item didn't get shipped? Now what do I do?
Oh
I
my.
may have to order from another company. I may have to ask one of my reps if they have something or if we can get one from another practice and they can bring it. Like there's so many different components to this, and it can be tricky, but once you're in it, you really get the hang of how to keep it going and flowing.
Yeah, and heaven forbid you have to cancel the appointment.
Oh God, no.
That
No,
that
no,
would
no,
be a
no.
problem.
That is, and if that happens, somebody might be out of a job. God forbid. Just
So
kidding.
I can
But it
see.
could happen. Who knows?
Huh? You say again? I'm sorry, I missed
I
that.
said I said, God forbid. I said, I'm just joking, but you never know. Yeah, if it's, that's the last thing you want to do. Nobody, that's the whole point. You don't
Right.
want to do that. Doctors taking time out of their money, I mean, out of their money, out of their day,
Hmm.
uh, for this patient, patients coming in, taking time out of their day to come in for this appointment. If we don't have what they need for that particular procedure, look out. Like that is not good.
So
And that
what's
should never, ever happen.
Mhm. So if we were to have the horse before the cart or the cart, I would think, you know, uh, in terms of logistics, we definitely have to have the appointments out front. We got to know what's coming, right?
Yeah. Yes.
So if
Yep.
we know what's coming, then we know what to order.
Hmm.
Is that the way you guys look at this? I don't know.
So, there are things. So when technically, if I'm setting up, so I'm working I'm working today, let's say, and I have patients coming in. The other thing we need to do is, the night before, 2 days before, look at the schedule ahead of time and see who's coming in. What procedures do we have coming up? And that's where what you're saying comes into play is, do I have enough of this? Is their case even in the office ready to go to insert if it's a
Oh,
particular
yeah,
case?
right.
Do I have the materials to bond that in there? Do I have everything I need? So, like I said, there's so many running components on a daily basis that
Yes.
keep practices going, and
Hmm.
it's having the people that are capable of doing these things.
Hmm.
And again, this comes down to training. This comes down to having systems in place for people to follow. Because if you don't have that, there's no, it's like it's out of order. Like you've got to be able to maintain consistency
Hmm.
on a daily basis so
Hmm.
that those types of things
Hmm.
never happen,
Hmm.
because that is everybody's worst nightmare.
Yes, yes. Yeah, so okay, so the Dental Assisting Collective, their mission exactly is what? Because I'm not sure if I heard that. Maybe you did, I missed it. Can you say that again, if you will?
So my goal is to support and
Mm-hmm.
empower dental assistants on the clinical side. So give them the proper training they need if there's something lacking,
Mm-hmm.
or if there's something that doesn't seem right within a practice and a doctor's having an issue with staff. I'm going to sit down with the doctor and I'm going to go, hey, what are you looking for to happen in here in order for your day to run more smoothly? So my goal is to get the dental assistants up to speed and up to par for that particular practice. And it's not a cookie cutter process. It's every office is different. I can't go in with the same, structured outline. Do I have systems? Yes. Do I have a guideline? Yes. But it's more catered to what this office needs compared to this office. So, what do I want? Like I said, I want dental assistants to feel more confident. I want them to feel empowered to make some decisions on their own without constantly having to go ask the dentist for permission for certain things. And sometimes that even comes down to what we're just talking about as far as ordering. Um, and building trust between, your coworkers, building trust with your dentist, and then everything falls into place. Like if you don't have a team that's working together, what do you have? You have a little bit of chaos. It's chaotic. So as far as what I do, like I said, it's teaching them some leadership, teaching them how to collaborate with one another, and making sure that, well, I know this, but I don't want you to know this because I want to be the only person who knows how to do this because it makes me look better. No, it doesn't. It never makes you look better. It makes you look worse. You want to make sure everybody knows how to do everything, because that is what where I reference an actual team. Like I always use basketball as a reference because my kids play basketball. If you're playing a team sport, and this is what an office is, it's like playing a team sport. If you have one person on the court that is not doing their job or trying to be singular and do their own thing, what happens to the rest of the players? Nobody's
Huh?
working together. It becomes chaotic. But if you have everybody working together and playing their roles and doing what they need to be doing, I'll say on the court and in the practice, look how much smoother things run. You can run plays like basketball. You can run systems
Yeah.
smoothly and efficiently. That's the goal. And to, again, empowering dental assistants, giving them the support they need on the clinical side of things, that's the whole goal. Because again, a lot of dental assistants are overlooked and undervalued. So again,
So
that's what I'm aiming for.
how do you find your clients, the dentists that want to put uh their dental assistants in an autonomous type of position? I mean, where they really, really understand what their job is. How do you go about finding those dentists that are looking for you?
Well, it's getting out there. It's doing things like this, and it's been just networking.
Hmm.
I think for me, it's all networking
Hmm.
and then just explaining to people what the goal is. Because again, so many offices, I mean, there's where we are, there's dental offices on every corner. Like you can find any dental practice. You're looking for a dentist, you could go up the street. But it's finding the practice um, that aligns with you and your values, and finding a good practice to not only go to, but that is doing things um, by the rules, by the guidelines, right? So that's how I get out there and I talk to people. It's a lot of networking and just sharing what my vision is for dental assistants,
Hmm.
and just hoping they pick up on it and going from there. Because again, like I said, there are some fabulous dentists out there that do a lot of work with their dental assistants, and then there are some that don't. And this is where turnover happens, because if you're working in a practice and you're just being run to the bone, nobody wants to work in an atmosphere like that. People want to work where they feel valued. And when somebody feels valued, they put forth more effort. And this is what type of practice you want to be going to and working in, somewhere where people feel valued, right? And empowered. And like you said, have the autonomy to do things, not crazily, but where they feel like they can do things. So that's where the empowerment side of things comes
Yeah.
in,
Yeah. Yeah. You're giving them
right?
the confidence to do what they do because they're in their seat. They're enjoying wherever it is that they do. And if
Yes.
they show that they're excited, that they're, just chomping at the bit to get what needs to be done
Yeah.
within their framework, then again, yeah, that makes life a lot easier for everybody because you do, as a dental assistant, uh, in my eyes, affect everybody in the office.
Right. Well, people want to feel seen. They want to feel heard. They want to feel valued. And when somebody feels like that, I know how I feel when I feel like that. I feel great. I go and you'll do even more than what's expected sometimes, right? And even something as simple as a thank you from a doctor. Thanks. Thanks, Joanne. That was a great day today. I remember the first time I heard that from a doctor, I was like, me? I'm like, oh, I'm like, okay. I'm like, you're welcome. I'm thinking, wow, yeah. I mean, it was a good day, but I'm like, oh, I was kind of in shock. But I shouldn't feel in shock hearing that. And, over time, this particular doctor was saying it more on a regular basis. And, it just helps uplift
I
your staff.
understand. I
And it
understand.
creates an environment and a culture where people want to go, not where people dread going,
Yes. Yes. This has been an
right?
education. I can tell you that for certain. I mean, I get excited when I'm hearing things that I didn't really realize. I just get excited about it. I'm so glad that you came here to share what you've learned over the past 30 years, and you're affecting a lot of lives. Can you share, if someone wanted to get in touch with you, how would they do that?
So I think the best way, you can find me on Instagram, and you can send me a message on my Gmail.
And
So
so what's your Gmail?
it's Joanne Ignatov at gmail.com.
Okay.
And
Okay.
then on my social media, you can just Google Joanne Ignatov and it will come up as dental assistant coach.
Okay. So you did say Instagram, but I met you through
LinkedIn and
LinkedIn.
LinkedIn. Yes, on
Okay.
LinkedIn
I
as well.
just want to make sure we say that,
Yeah, yeah.
right?
Sorry, yes, thank
Okay.
you.
All
Yes, on
righty.
LinkedIn as well. You just Google my name and it'll come up or like
Awesome.
search it up.
Awesome.
Yeah,
Awesome.
yeah.
Is there anything that you want to add as a closer now that
So
uh,
I
went a
do.
full hour? Go ahead.
I could
So,
talk for hours. You get me started, I'll keep going.
yeah, yeah, please do.
But something that I did want to say was that true wealth comes from alignment, right? So with your purpose and people and your patients. So when you invest in your team and your culture, as much as you might invest in technology, you don't just grow a practice, you'll grow a legacy.
I like that. That's what you want, legacy. Until, I
Mhm.
mean, even when you're gone, just framing, the work that you laid out,
Yeah,
people are going to probably still use a lot of the information that you left behind. So yeah, that's definitely a legacy.
yeah.
Thank you so much, Joanne, for coming in this afternoon and joining us and giving us all of that great information. Um, I want you to have a great day and let's talk again in the future.
Yeah, it sounds like a plan. I really appreciate you having me on board. It's great. I love sharing my experiences and what I've learned over, my years working in this dental field. So thanks again. It's been awesome.
My pleasure. The Wealthy Dentist podcast is built on connections, opportunities, and meaningful conversations that help jumpstart careers and boost the ROI on your business. Is there a topic you're passionate about or someone in the dental community who should share their story with us? We want to hear from you. Email your suggestions to the Wealthy Dentist Podcast at gmail.com and let's create content that informs, inspires, and uplifts the dental world. Your ideas could spark our next big conversation. Let's make it happen. I'm Ward Powell, your host at the Wealthy Dentist Podcast, thanking you for being a part of our journey.